All right, so today is World Sickle Cell Awareness Day. Yes, it's a day that we need to pay so much attention, and that's because we're having people who are living with this kind of condition. I don't want to call it a disease, but of course, my guests are here, and they'll be letting us in on how we can harness the momentum of World Sickle Cell Day for real change in Nigeria. And joining me in the studios this morning, I have Dr. Oreoluwa Alabi. If you're wondering who he is, he's the clinical project specialist for Xcene research. Dr. Alabi, nice to have you in the building. Good morning.
Good morning. Nice to be here.
And how are you doing?
Awesome. Perfect.
All right, then. I also have in the building this morning Uchechukwu Nwaoha. All right. Uchechukwu Nwaoha is clinical trial associate lead for Xcene research. Uchechukwu, good morning.
Good morning, sir. It's a pleasure to see you this morning.
Wonderful. So both of you are making your first entry into traffic radio, I suspect.
Yes.
All right, Dr. Alabi, do you listen to us?
Once
in a while.
With what I'm hearing, I think this is something I definitely look out for traffic information in Lagos.
Look to your left, you can see the roads, right?
Yes. It's fascinating.
It's really fascinating. Yes. And we can actually zoom in on your car, so we can, fish you out anytime we find you committing some errors on the road. So what do you make of that?
As a law-abiding Lagosian, I'm sure you will not catch me breaking any laws, any traffic laws.
All right. Uchechukwu, what do you make of this screen showing the roads?
Amazing, really. Now I know that we are truly being watched. but yes, for the better part of my secondary school days, driving with my dad, he listens to traffic radio every morning.
Wow.
As he steps out from the house like 6 a.m. So
great.
You help him navigate.
Okay.
Anyways, I know it's traffic radio. I sleep sometimes, but it's awesome and amazing. Yeah.
All right, then. So let's just jump in on the focus while you guys are here. And I think the most convenient point for us to actually begin this conversation is to get into your world and connect with what you guys do. So what is Xcene research all about, Dr. Alabi?
So basically, Xcene Research is a contract research organization, and what we do is we help find solutions to medical challenges, right? For example, working with sickle cell disease, we're carrying out trials or clinical trials that help to find advanced form of treatment that will help better the lives of people that have
living with it.
Disease. Yes,
wow.
Reduce the crisis, reduce the hospital admission rates,
right.
Reduce VOC trials, and a lot of these things, VOC events, and a lot of these things would only happen when new compounds that have the potential to help them live a better life are tested, right? So that's what Xcene basically does.
But it's not only sickle cell that you guys focus on?
No, not just sickle cell. But
what other ailments?
At this point, we have our hands into renal medicine.
People that do that one as well for kidney issues.
Yes, exactly.
Wow.
Chronic kidney diseases. Testing out medications to see how they can help improve and slow down the rate of kidney degeneration.
And Uchechukwu, how long has Xcene research been around?
Beautifully, we're going to be 10 years in a few days.
You don't mean it?
Yeah.
Wow.
So we've been carrying out clinical trials in Nigeria and Sub-Saharan Africa for the better part of 8 years, right, out of these 10 years. And just like Dr. Ore said, we're really big on sickle cell, having over 8 therapeutic studies, industry studies on sickle cell. But we have done nephrology, cardiology, a medical device, neurology, basically trying to find out better medical solutions for these different therapeutic areas.
And you've been with them all this while?
I have been with Xcene for 6 years. This is my 6th year.
Wow. So you're a big boy.
If you want to say.
All right.
It's a privilege, yes.
So let's jump in on the essence of this day, really. So World Sickle Cell Awareness Day. Of what significance is this day, Dr. Oreoluwa?
Like every day that's usually celebrated, the idea is usually to create awareness about that particular ailment. And sickle cell is actually a priority because if you look at the burden of sickle cell worldwide, blacks, which Nigerians are a major population, we are the ones that are majorly affected, right? Blacks around the world, and fortunately, unfortunately, Nigeria is the most populated black country in the world at this moment. So it means that the burden of sickle cell is actually more than more. It's pretty significant. I can't go into facts because I don't have that at the moment. But we have quite a large burden of sickle cell patients. I'm sure that people growing up somewhere within my generation would hear, while you're growing up, you hear people say, "Oh, somebody's a sickler."
That's true.
Exactly. So people like that, they easily fall sick. You just hear, so somebody's on admission, he's complaining of body pain, joint pain, he can't walk. Yes. So
sorry to interrupt you, but does it appear that most diseases are quite discriminatory towards blacks? Because earlier this week I was talking about cancer, male cancers, and the doctor was also saying blacks are the ones most affected. So how come those diseases seem to discriminate against blacks? What do you say?
So I would narrow it down on sickle cell, and so sickle cell. I mean, the sickle cell gene is an evolutionary change, right? What it means basically is the normal genotype we were used to having back then in the days. I'm speaking to centuries. Is usually the AA genotype, right?
Okay.
But because the AA genotype is prone to mosquito bites and malaria, which is endemic in Africa, right? So the body devised the method to say, okay, so if the AA genotype is prone to malaria attack and malaria infection, so there was a genetic change that occurred that produced the S genotype, right? So that's why you hear people say that people that have the AS genotype, they rarely fall ill to malaria, right? But the problem now is the S genotype, right? It's a malformed, it's not the correct thing. So what happens to people that have sickle cell is that sickle cell disease is that when they have two AS people come together and they both donate the SS genotype, right? And then they have a child that has SS.
So by implication, you've told us what an SS is, right?
Exactly. So the problem now with sickle cell is that a patient or an individual has two deformed cells.
Wow.
So instead of maybe an AA or an AS, right, the person has SS, which is the two sick ones. So
is the S part of this genotype, is S defective?
Exactly. S is the defective body there.
Wow.
It's the sickle gene.
All right. So, Uche, how common is sickle cell globally? And of course, if you narrow it down to Nigeria, how common is it?
Sickle cell is actually very, very common. In the like Dr. Ore said, it's more common in the African space. And in Nigeria, Nigeria has the highest burden of sickle cell actually in the world.
We have the highest burden?
We have the highest burden of sickle cell.
How come we come with that kind of record?
Well, that's when we now talk about, okay, what are the, like Dr. Ore talked about, the medical causes of sickle cell. Right. But of course, it goes beyond just, we see the medical consequence, but if you look at the root cause is actually from how the AS father and the AS mother came together.
So let's talk about that, really, because that has been an age-long debate. And I'm thinking that in 2025, we should have overcome that, Dr. Alabi.
I mean, you would imagine that by now, genotype testing before marriage
should have become
would be a norm.
Yes.
But there's also that part, and then honestly, you have people who they did not plan to get married or have children, and then children come up, and then you also see that that's another population where we have the sickle cell occurrence from. So say, take for example, somebody has a partner and they have not checked their genotype prior, and then one of the partner gets pregnant. Right. There's also that part, and then I know that there's a generation where in the past when they do that testing, because we have different variations of sickle genes, right? We have the AS, we have the AC, right? There was a generation where AC was not commonly tested, right? And then it was just assumed that it was just AS, AA and ASS, right? So there's a generation where people grew up learning that they are AA, only to get older and then find out that they are not actually AA, they are AC. And even the C is a variant of the deformed gene, right? So for sickle cell we have SS, right? That's the sick individual. We have the SC, which is also a variant of sickle cell disease. We have the sickle cell beta thalassemia. That's not common in this part. The African, yes, it's more with the Mediterranean population.
Okay.
But for our region, we have the SS and the SC, right? And like we're saying just before we stepped in, and we're talking about what are the ways that we can actually curtail this, and then we're saying something about how religious bodies and traditional rulers can step in, right?
All right. So those are myths, right? Myths that help to transmit or perhaps to increase the population of AS, so to say.
I don't think myths are not. That's not the word. These are facts, right?
Okay.
That's how it happens.
Okay, this is factual, right?
Yeah.
So, but I am curious. So the only way, and now sickle cell is not a condition whereby it jumps on people through, let's say, infection or transmission or anything. So it is caused basically by AS versus AS.
Exactly.
Or SS
versus AS.
Versus AS.
SS and SS.
Or SS versus SS,
exactly.
Right?
Yes, sir.
So it is taken that if an SS father meets with an SS mother, they're likely going to...
All their children will be SS.
All of them?
Yes.
No exception?
No exception for SS with SS. No exceptions.
Right. So if that's the case, I mean, we should have known that. People should have been able to know their genotypes, and then they can be able to predict, look, once I find out that I'm dating someone who is SS, then maybe we do not need to go there.
Okay, so I would just run through a brief rundown of the genetic genotypes that are very compatible, right?
Okay.
AA and AA, perfect.
Compatible.
AA and AS, perfect. AA and SS, it can work, right? Because it means that at no point would we be having the risk of having two SS genotypes in one child.
Okay, so AA and SS.
With AA and AA, perfect.
Okay.
AA and AS,
good.
Perfect. AA and SS, perfect.
Oh, is S perfect too?
Yes.
Okay, good.
I mean, it works. It means that if an AA father and an SS mother marry, the worst they will have is they will have SAS children, not SS. They will have AS. So their children will be carriers of the sickle cell gene,
right,
not infected with sickle cell.
So, but AS and AS
bad combo.
Is a no-no.
Yes. AS and SS.
SC
and SS bad combo.
Okay, and then AS and SC also
terrible combo, because there's a risk of having a child with sickle cell.
All right, so Uchechukwu, I know you must have come across different scenarios.
Yeah.
These are, I mean, young guys. They seem to be so much in love. AS, they've gone to do their genotype and they find out. Well, let's use faith and push it. I mean, we can just. I mean, God will intervene.
I know. And truth be told, right? There's that peculiarity of saying, oh, God will intervene, but there's also a wisdom to this thing, you know. And I think it's best when you're starting off, you're asking the right questions, you know. And one of the right questions to ask when you're going into a relationship, it's your genotype, you know. That gives you a reason to say, okay, we can take this forward, or we cannot. It's just like any other question you will ask as concern, okay, where you're from, what you believe in, and things of that nature. Another thing that's really important, because this time around you are taking cognizance of the health of your children, because trust me, if these children come out, you understand, if they come out with the SS, it will be a whole lot of psychological tone. It take a lot of psychological tone on the parents, on the children. Financially, it is also going to affect them. So at that point, trust me, the love that they once had
will disappear.
It might not disappear, right? But it will be put to a whole lot of heavy tests.
Let's talk about common symptoms and the complications of sickle cell. Maybe those who are listening to us right now will be able to understand the reason why that AS versus AS love shouldn't work. Dr. Oreoluwa, what are these signs?
So just before I go to the signs, Uche was speaking to how sickle cell can destroy love, and I have seen it firsthand, and it's frustrating, right? But what are the common things you see with people that have sickle cell? So the first thing is they have very random painful episodes that we call painful crises, right? The pain can literally be anywhere part of their body, from their hands to their chest to their legs, right? People with sickle cell, they are prone to infections, right? They're also usually very tired. They get tired almost every time, because they have what we call anemia. And anemia means that the blood level is low, and that's as a result of the deformed blood, red blood cells they have is easily destroyed. So their blood level is almost always low. So they're always tired. They are prone to infections. In children, you see children that have swollen hands and feet, because when that blood vessel, when the red blood cells clog, it blocks the blood vessels, they cause swelling in their hands and feet. In adult males, they have what we call priapism. And priapism basically is a condition where a man has the word we use is purposeless, painful penile erection, right? So there's a penile and erection that it's not as a result of sexual
infection.
It's not as a result of a sexual urge. It's just erection that just occurs very randomly. It's very painful. Very painful, and we use the word purposeless because it was not triggered by sexual desires. So those are major complications with sickle cell disease. People with sickle cell disease, they have a risk of developing what we call ulcers. They are injuries that they don't heal very fast. They heal very slowly because the red blood cell is very important. It's vital to life. And because people with sickle cell, they have deformed red blood cells, that means their blood cells, they get destroyed fast.
So there's a whole lot of complications.
There's a whole lot.
All right. So is it curable?
That's a very interesting question, right? I would say yes and no. I will start with the no because the method for globally, right, the cure is still being researched. There are various methods that have been prescribed. There's the gene therapy, but those are very, 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 very expensive procedures that they are still being tested. We've had maybe one successful case with gene splicing. So it's basically having to work around the genetic composition of the red blood cell, of the human genes that will produce the red blood cell. So they are very expensive. We don't have that even in Nigeria at this point. So in terms of cure, there's a future cure. I think maybe in another 10-20 years we might be speaking of a very conclusive cure. But right now, nothing that is worth the risk.
Anyway, I hope we have a lot of time so we can look at the complexities and everything. But Uche, how are you guys marking today? Xcene research?
For Xcene, like I did mention, we're really, really big on sickle cell because it draws back home. Like I did mention, 1 to 2% of the Nigerian population have sickle cell. And that's a lot. If you look at just taking a random number of 200 million persons, 1% of 200 million persons is, we're talking about 2 million,
about 2 million people.
Over 2 million people with sickle cell, which we know that it's a lot more than that as the case is. So because we're a contract research organization involved with sickle cell, we stay to always show them that we are supporting them. You know, we work with the sickle cell organizations, various sickle cell organizations and foundations, to be able to help with their support, you understand. And then we've also developed the Gene Score app, which helps the sickle cell community, and that sickle cell community, they are able to access medications, lab support, pharmacy, hospital consultancy for their need. You understand. And then we also bring together the sickle cell community through the app so that they can have their own support. Because there's one thing to be speaking with somebody who has the same, so that you know that okay, we're together. But we are also there also to say that, come on, see, you are normal. You know, you are not, don't see yourself as abnormal in any way. You are just a human being, just like I am. You can do the things that I can do. You can work in the same organization that I can work in. You understand? So we are always with the community. So you're providing the patient advocacy groups that we work with.
So you do a whole lot of support for them.
We do a whole lot of support. We do a whole lot of outreach for them. We do a whole lot of community-based dialogue to be able to find out their pain points.
Anyway, I think you just answered Oluchi's question. Oluchi is sending in a message this morning. Oluchi says, "Good morning, Traffic Radio. Is there any help for people who can't afford all these tests and medications?" And I think
yes. So if you the Gene Score app is already live on the web, and then we will be putting it on the app. That's the Google Play Store very soon.
What's your website?
www.xceneresearch.com.
Xcene Research. Xcene as in EX?
Yes. X like xylophone.
All right. Okay.
X as in xylophone, then C, then E. C as in cat.
All right.
E as in egg. N as in November. November or Nigeria, then E as in egg again, then research. Research is R, then E, then S, then E, then A, then R, then C, then H.
All right, then.
.com.
We have to go. We've got out of time, really.
Okay.
But there's a message here. It says, "Good morning, Lagos Traffic Radio. Sometimes nurses and doctors show zero empathy. How do we fix that in our health system?" Olushisi is sending that one from Okwebi. Well, I think we have another time that we can look at all of this.
Okay. So maybe just to speak to that. So we also work with the consultants across sub-Saharan Africa, like I mentioned, but especially since we're in Nigeria here, we have a lot of consultants, hematologists that manage sickle cell patients from the adult to the pediatrics. So we do that, and then we've also launched our lab and diagnostics.
Where are you guys located, Xcene?
In Ikeja off Allen Avenue.
Okay.
That's where our office is. But our lab and diagnostics, which is coming up, is at Kudirat Abiola, which is not so far from. And then we will be able to offer both testing for sickle cell and then medical research also, because we're taking that forward to be able to look for local research solutions that can meet the Nigerian need. But like Dr. Ore said, in 5-10 years, we should be saying that sickle cell is out and eliminated.
We'll leave it at that for now. It's nice having both of you in the studios. Thank you so much for being here.
Thank you very much.
All right, so we're trying to harness the momentum of World Sickle Cell Day for real change in Nigeria. And you heard from my guests this morning. They'll be able to talk to us on what we need to do at all times and how we can also get help as well. Dr. Oreoluwa Alabi is a clinical project specialist for Xcene research. Dr. Alabi, thank you so much for being here.
Thank you very much.
And Dr. Uchechukwu, not Dr. Rather, but Uchechukwu Nwaoha is a clinical trial associate lead for Xcene research. Thank you so much for being here.
Thank you so much, sir. It's such a pleasure. Thank you for having us.
Okay, then I must say, and I almost appreciate Dr. Ogunyemi, who is the director of corporate communications for Xcene research. He's been working behind the scene for this program to come on stream this morning. We're going to take a short break. When we return, we'll try and see if we can do our birthdays before we switch gears to Build Right.